All right, everyone, welcome in. It's good to see folks flowing into the webinar. I'll give about a couple more minutes before we get started. For now, I'll just go over a little bit of housekeeping or things to know going into the webinar. So folks, all of you are muted and off camera for the entirety of the webinar. The webinar is also being recorded. Another thing, chat box should be on the right-hand side, depending on where things are placed on your screen. Just find that little box that's for your use. So if you have any questions or comments throughout the webinar, please go ahead and use that chat box. I strongly encourage you to participate. We have a great set of panelists who are here with us today. That said, we have a window of time at the end of our discussion to host a Q&A. It'll be about 15 to 30 minutes, depending on your questions and how much time we have. Of course, that could always change. Recording and presentations, or the recording of the presentations will be sent out in a follow-up email as well as the slides. So if there are any other things like resources, such as web pages or documents that are shared throughout the discussion, you'll receive that tomorrow. There'll also be a recording on our YouTube channel and our website. So our YouTube channel is the National Coalition for Homeless Veterans. Our website is nchv.org. You should be able to access the first half of the series. So 2 of the webinars have already been uploaded. They're great. One's on staffing challenges and fundraising practices. If you missed out those first 2 weeks, go ahead and visit our website or our YouTube channel. So for those of you who might be new to the work of the National Coalition for Homeless Veterans, or NCHV for short, our role is to disseminate best practices and uplift communities to help put an end to veteran homelessness. So we connect service providers and with folks who are at risk or experiencing homelessness to the resources that they need. And we also do tons of work in the policy space. This webinar can't be done without the generosity of the Home Depot Foundation, which this project began back in 2021. So we're about 3/4 of the series and 3/4 done, or I guess 1/2 done. We're on our third out of the 4 webinars in the 2023 series, which is titled Optimizing Internal Operations to Better Serve Vets, which goes over the many operational challenges that service providers might face and practices to overcome them. So on the note of practices, the topic for today is actually on establishing best practices, specifically setting standards in quality assurance and program compliance. So one of the key takeaways from the last 2 webinars, one key takeaway from the last 2 webinars is that to provide clients with quality services, people or organizations must be equipped with the resources to carry out that important work. Now, it's equally essential that organizations can best utilize those resources to set systems of good practices in place. If the goal is to meet the unmet demands of veterans, it's critical to evaluate where the gaps are to further improve programming and other services. So there has been a lot of excellent work done by service providers to lower the count of homeless veterans throughout our country, and there are still thousands of those in need. So identifying and employing those helpful tools empowers providers to help close that gap. So with that said, we have a great panel that'll delve into some of those practices and ensure how veteran needs can be met. So first, we'll have Garrett Bollinger from the New England Center of Homeless Veterans. He's the Director of Performance Monitoring and Evaluations. We'll talk about using data as a foundational asset to help assess and improve services. Then we'll close off with Antoinette Fields, SSVF Community Relations and Compliance Manager at Hope Atlanta. She'll discuss establishing standards to ensure compliance as well as building an organizational culture around it. So we'll have each of the panelists introduce themselves during their presentations, and I'm going to go leave now and we'll basically go on mute and go off camera. And before I part ways, again, I strongly encourage folks to use the chat box to put forward any of those comments and questions, and we'll address them during the Q&A session. So let's go ahead and get started. Garrett, start us off.
Great, thanks, Jay. Good afternoon, everyone. My name is Garrett Bollinger. I am the Director of Performance Monitoring and Evaluation at the New England Center and Home for Veterans in Boston. I'm coming up on my 4-year anniversary there. Next slide, please. So just to tell you a little bit about the center, our mission is to equip veterans who are facing or at risk of homelessness with tools for economic self-sufficiency and to provide them a path to achieve successful and dignified independent living. We've been located in the heart of downtown Boston since 1989. We offer transitional and permanent housing with extensive on-site wraparound services, including housing search, medical and behavioral health care, substance use treatment, clinical case management, employment services, legal services, and group activities all under one roof in Boston. We are a regional grantee for SSVF, HVRP, GPD, and various VA healthcare for homeless veterans programs. And lastly, through our community-based programming, we maintain a footprint across all of Eastern Massachusetts and Rhode Island. Next slide, please. So speaking of data, I did want to share some of our internal data of what we've accomplished in the last 12 months. So we have served 1,045 unique veterans across 22 programs, of whom 60% were age 55 plus. We provided transitional and low threshold housing to 431 unique veterans. 92% had a disabling condition, which I always find pretty astounding, that number. And we had a median nightly census of 150 unhoused veterans. We placed 181 unique veterans into permanent housing, despite Boston being the country's second most expensive housing market. We prevented homelessness for 88 unique veterans. We delivered intensive employment services to 194 unique veterans through HVRP, of whom 68 were placed into jobs with an average hourly wage of $20.95. And we also provided permanent on-site residence for 112 unique veterans. Next slide, please. So why invest in data infrastructure? That's what we're here to talk about. So it gives you the power to confidently tell a story about your organization's impact. It takes out a lot of the ambiguity and guesswork when you need to tell that story, when a funder asks for information about your impact, or a donor or community leaders. It helps various stakeholders make data-informed decisions. Notice I did not say data-driven. We could have a whole separate talk about that. Data-driven usually means that data is the primary or only factor used to make decisions, whereas data-informed allows for more qualitative stuff. So feedback from staff and feedback from veterans. So I always like to say data-informed instead. Investing in data infrastructure improves the ability to be proactive rather than reactive. You're able to find or uncover issues before they become entrenched in your programs. It creates efficiency and ownership for frontline staff and veterans. It prepares for the future, as I'm sure all of you on the call have noticed over the past decade or so. Funders are increasingly interested in learning about your program's impact, less so about how many people did you serve, how many services did you provide. They are increasingly interested in measuring more of those outcome-based measures. And lastly, it facilitates ongoing monitoring and quality improvement. Next slide, please. Great, so building an organizational data culture. This is a very kind of black and white approach. Obviously, there's a lot of gray in the middle, but some organizations view data as a burden, where others view data as an opportunity. And not to make, I'm not trying to make generalizations, but organizations that view data more as a burden see data as kind of that necessary evil, right? So maybe if the funder wasn't going to ask you to collect it, you probably wouldn't. Organizations may find, may collect the bare minimum of data. Those of you who have HMIS projects, maybe you're just collecting HMIS data as mandated, but you're not really doing anything in addition to that. You're not customizing things. There might be an over-reliance on funder report backs. So instead of you knowing what your progress is at any given time, you're waiting for your funder to tell you what you have achieved and what your progress is. There might be significant redundancy or overlap in systems and data collection. So you might collect or ask the same question 3 different times across various platforms or different forms. Your staff may have insufficient ownership and knowledge of data quality, lacking of in-house technical expertise, and paper files continue to be the primary way that records are stored. So inversely, agencies that view data as an opportunity see data as strengthening the organization's ability to serve veterans and inform decisions. Data are consulted and cited by various stakeholders, including development, which I think is an important piece. Program impact can be tracked in real time. You're not waiting for that funder to tell you how you're doing. Staff are provided tools and resources to ensure the highest possible data quality. You may have a dedicated data staff or data team, and you would ideally have what we like to call at New England Center an electronic first approach. I think all of us know that we will never be paperless as homeless service providers, but we can kind of strive to get to a place where an electronic record is the primary record for veterans. Next slide, please. So these are just some best practices that we've identified over the years at New England Center and Home for Veterans. The purpose of this, again, is not to be prescriptive. I'm not trying to tell you what to do, just maybe trying to give you some ideas of ways that you can bring these practices to your own organizations. So these include recurring data quality initiatives, performance dashboards, technical capacity and expertise, consolidated data collection systems, data ownership, and thinking bigger. Next slide, please. Great, so recurring data quality initiatives. At New England Center, we have weekly or monthly data meetings with program leadership. That's basically instilled and built into all of the program administration of our various programs. Within those meetings, we identify themes for improvement, but we also, more importantly, identify themes of success. What are we doing really well? We also do plan, do, study, act cycles, PDSA. I don't feel like most of us actually call them that in practice, but if you think about it, we're finding an issue, implementing a small change, and then studying that change, and then seeing if, are we going to keep that change or are we going to try something else? These meetings also create a feedback mechanism, so we can always make sure that staff are accountable and aware of data issues. Speaking of HMIS, we do weekly HMIS data pools and quality checks. We're actually very, very lucky to have an incredible in-house manager of HMIS data systems, who is an expert in all things HMIS. So this allows us to fix errors as they happen, allows us to be proactive, reduce stress at the end of the month when it's time to upload to the VA's repository. And we also have the ability to access and query HMIS data from many sources, which creates redundancy and allows us to cross-reference our HMIS data. Next slide. Performance dashboards. So performance dashboards are really helpful to track outputs and outcomes in an easily digestible format. Ideally, they would look nice too. There is something important about data visualization on a performance dashboard. Ideally, these include funder deliverables, but can also include internal targets and metrics. As we all know, sometimes internally we care about slightly different things than maybe a funder cares about, or we like to look at things in a slightly different way than a funder looks at it. So that's a nice thing about performance dashboards and customization, is that you can kind of look at things however you'd like. Performance dashboards also increase buy-in. Staff can see how their work translates into results. I think a lot of times you hear direct service staff say, well, I enter this thing into the database, but I don't know where it goes, and I don't know how it's helping us measure our impact in any way. And a performance dashboard kind of alleviates those concerns. You're able to show very clearly how the data you're entering into the database helps us measure our outputs, outcomes, impact, etc. And lastly, performance dashboards ideally require fairly minimal manual manipulation. That is definitely something we're always striving for, but ideally you would be able to run them for any date range with a certain amount of automation. Next slide. Technical capacity and expertise. So this is going to look very different for every organization. I am very aware that not every organization can have a full-time 3-person data team. So I'm not trying to tell you that that's what you need to do. But however, hopefully you can figure out ways to increase your internal capacity and expertise, whether that's someone like a program director taking a few classes on the side, or hiring a consultant, or getting an intern who has more of a technical expertise. I won't lie, this requires a lot of investment, both time and money. It takes a lot of time, and if you want to adopt a fairly robust data system, it's also going to require a lot of monetary investment. But things to ask yourself, do those benefits outweigh the cost? Will having a better grasp of your own data help you maintain existing funding and help you attract new funding? Being able to tell that story, your organization's story, in a better way may really help attract new donors, new funding opportunities, etc. Also, having internal technical expertise allows program staff to focus on providing services rather than crunching numbers. I think we all know program directors who really have to juggle a lot, where their primary training is in service provision or in social work. But then they're also being asked to fill out complicated spreadsheets or reporting forms. And this allows them, having internal capacity allows them to not have to do that, to be able to focus on the veterans. And lastly, again, it will take time. Our data transformation has taken between 5 and 6 years, and it is ongoing. Technology always changes, expectations always change. It is an iterative process, so don't think that it's ever going to be completely finished. Next slide. Consolidated data collection systems. So anyone on this call who has gone through a database migration at any point knows that this requires very significant effort, but I do truly believe it pays off in the end. It's more efficient for all stakeholders. It saves staff time. It reduces the need to train in multiple systems. It's not uncommon in our line of work for a staff person to have to enter a service in 2 different databases and then also have it in a paper file. Having one place where it is entered saves everyone time. And I think this often gets overlooked, but it's also a lot better for veterans. I can think, at New England Center, a lot of our intake assessments have fairly intimate questions, right, about someone's substance use history, about someone's incarceration history, things like that. And if you are constantly being asked those questions over and over again, because there is a lot of redundancy, that can maybe be a bit traumatic for veterans. That's definitely something we've heard internally. So that is another benefit of consolidated data collection systems. And the last point here, if you have a system organization-wide that is consolidated, that definitely facilitates care coordination and collaboration. So one of the things we're really proud of at the center is all of our human services team, all of our direct service staff have access to see what all of their colleagues are doing with their same veterans. So people on the HVRP team can see the work that SSVF is doing. The SSVF team can see the work that the clinical case managers are doing. It's a very kind of open environment, and that definitely helps with care coordination. So you're not operating in silos. Next slide, please. That's not my slide. David, do you want me to just pause here, or?
Yeah, Garrett, I think that was the last one I had up. So I think that was the last slide. Yeah. So if you can continue, I'm not sure, but that's the last slide I have for you.
Okay, I I sent the whole thing, but I will
Thank
go
you.
off script, I guess. 1 second. So after consolidated data collection systems, we had data ownership. Having data ownership creates clear and documented data collection protocols to increase accountability. If you have routine check-ins with staff around data collection and reporting, you're able to identify, again, issues as they arise. What could we be doing better? Is there anything we aren't collecting that we should? And that also kind of reduces that tension that can sometimes arise between data staff and those who are doing the work. Lastly, the last best practice was thinking bigger, which allows you to harness the data. Thinking bigger. A lot of us are often in kind of crisis mode when it comes to data. We're constantly putting out fires. It's the end of the month. We have a bunch of reports due. We're noticing all of these data quality issues. So we're kind of going from one fire to the next. Whereas investing in data infrastructure, building stronger systems, it allows you to free up some time and capacity to think bigger. So it is definitely a paradigm shift. Just to give you a few examples of what we've done at New England Center to think bigger, that would include equity analysis, housing placement follow-ups, internal veteran satisfaction surveys, and an analysis on returns to homelessness. So who are our veterans that are returning to us after a certain amount of time, and why are they returning to us? Are we noticing any commonalities in that population? So it's going to be a bit hard for me to talk about the next few slides because they really rely on visuals. I'll tell you, I was going to do a case study on the SSVF program at New England Center, just to give you a few examples of systems we've created. So just to give you an overview of what our data infrastructure looks like, we use a database called ETO, which is a product of a vendor called Bonterra. I'm sure many of you are familiar with ETO. And it has a built-in reporting platform called SAP Web Intelligence. So in our ETO database, we have 48 custom forms and assessments across 39 programs. We have an integrated HMIS data collection and reporting. We have historical data going back to 2014 for over 4,000 clients. We have the ability to deduplicate. We have 20 plus custom reports that can be run in real time. Those include performance dashboards and data quality reminder reports. We have 70 end users, 2 database administrators, and 2 test environments. And just to quickly give you some examples of innovative approaches we've taken for SSVF, we've really embraced technology in our SSVF program. Oh, there it is. Cool. Okay. Innovative approaches for SSVF data. Program eligibility is calculated using electronic forms. So those of you familiar with SSVF know that the VA has published forms to help determine SSVF eligibility. We've replicated all of those forms electronically within our database, and we determine eligibility directly in the database. We upload all proofs of income, program agreements, termination letters, and all signed documents directly into the database. We store individual service plans and 90-day recertifications directly into the database. There's no paper there at all. Our staff enter all services directly into ETO, including HMIS. We're able to easily see veterans receiving shallow subsidy, housing navigation, healthcare navigation, and hotel services. And we have real-time data quality and performance dashboard reports. Next slide, please. Okay, so the next slide had some screenshots of some of our various reports. I think we can probably get that sent out to all of you. but I was going to show you the currently enrolled report, which shows everyone who's currently in the program and their real-time data quality. So do they have expired ISPs? Do they have expired recertifications? That report is filterable by caseworker, veteran name, program type, are they in RRH or homeless or HP, homelessness prevention. It uses color coding. Okay, that's the last slide. Can you go back one more? There we go. Okay, so there we go. This is the screenshot of the currently enrolled report. So as you can see, there's the color coding showing the status of recurring data quality items such as ISPs and recertifications. It shows the most recent date of service. This is really just a tiny snapshot. It's actually a quite big report. I just did a screenshot of the most important columns. And again, this updates in real time and it can be accessed by direct service staff. So there is an expectation that staff run this at least weekly, if not more frequently. So they're able to identify items as they are expired or become past due. And it is occasionally used as a supervisory tool as well. And that goes back to the accountability loop that we like to have around data. Next slide, please. Okay, and lastly, this is the SSVF performance dashboard. This is just sample data, completely fake, has nothing to do with our actual performance. But I just want to show you an example. This can be run for any date range, ideally the fiscal year or program year that you're currently in. It can be updated annually to reflect current goals. It contains both VA and internal targets, and it is reviewed at minimum monthly with the team. So as you can see here, we have all of the various metrics built out. They're coded on the back end in a way that matches how the VA's own repository would code this data. So the numbers almost always match up exactly. And you can see we have color coding based on how close we are to achieving that goal. Next slide. And this is the second page of the performance dashboard. We have veteran demographics, so who we're serving, a breakdown of the services we're providing, and a breakdown of the TFA that's being provided. And next slide. And lastly, this is the last page of the performance dashboard. This is our equity analysis for rapid rehousing. So as many of you know, funders, especially the VA, many of us are familiar, I'm sure, with the VA's equity initiatives. We are increasingly interested internally as well at looking at program equity and making sure that our programs are serving different groups and identities equitably across program stages. So this is for rapid rehousing. The first column shows those who are served by rapid rehousing. The second shows those who are exited from RRH. And then the third shows those who are exited and exited to permanent housing. So here you're looking at the proportionality or comparing the proportionality of race, ethnicity, and gender across all three segments or all three stages. And you're looking for major gaps or disparities. So we look at this at minimum monthly as well. And then last slide, that is everything I wanted to cover. So thank you for your attention. I know we have a Q&A, but if you have any questions, please feel free to email me at garrett.bollinger@nechv.org. I appreciate it. Thanks.
Hello, everyone. I'm Antoinette Fields from Hope Atlanta, the Community Relations and Compliance Manager. I have been with Hope Atlanta. It will be 10 years in February. I've always worked with the SSVF program, and I'm proud to say that this program has grown tremendously since I first started, and very happy to be a part of that. So we're going to talk about, have a little dialogue about compliance. Can you go to the next slide? Thank you. So what is compliance? How do we add regulation? It's how we add the regulation and operating guidance to our program. In our SSVF program, we have a program manual that gives us, that governs how we operate. It lets us know what we should do, how we should do it for the most part. But most importantly, with that program manual, we have to look at our internal operations and what we use to aid in that manual. The status and standards of functions which require adequate resources supported by a framework of reference and processes that embed and help us in that day-to-day activities of our organization. We provide the resources. We are provided with some resources and processes, but we must drill down deeper and fine tune what information we must meet in order to help our staff and help the clients, because they're part of the compliance our compliance also. When we look at our programs, day-to-day activities, do we think about it? Is it efficient for the services that we want to provide? What other program processes have you had to implement in order to fine tune those operations and make sure that you are following the standards that we need? Our standards and procedures are outlined in the program manual and our agency manual, but how are we adding to that to ensure that we are compliant? We know that those program manuals, it's a live living document, and we have to update it as the changes come about, as we see needs. And it's very important that that documentation is stored and making sure that it's available to the staff. We want to make sure that we are adhering to the local, state, and federal jurisdiction that governs our operations. SSVF works very closely with the COCs, who have standards that we have to adhere to when we think about our coordinated entry, HIMS data standards. We know that we have to look at those things also in order to make sure that we stay in compliance. And lastly, we know that compliance is married to data. Garrett did a very good presentation on showing how those things work. We know that it helps us to identify those key KPIs that shows our strengths, that shows our weaknesses, how we prioritize what needs attention. Who are our underserved? What are our victories? What are our victories? We see this in the 38K initiative that we've been going through with SSVS to house our veterans. Next slide, please. How does compliance improve our program? Can you go to the next slide? How does compliance improve our program? It ensures that we follow a standard operating procedure. Is what we're doing, is that working? How we operate, is it working? Are we seeing that we're following the rules and guidelines, and are we serving the people that we need to serve, which are our veterans? Creates a centralized source for information and guidance on all compliance obligations. So when we look at that centralized source, where do you have that in your program? We use SharePoint to store everything. All of our files are electronic. With COVID, we had to go to we went away from paper and we converted everything electronically, and everything is stored on our SharePoint. All updates, program guides, manuals, anything, training material, all of that information is stored on our SharePoint. prepares us for program growth. How does compliance prepares us for program growth? It improves the financial performance and long-term sustainability of programs by minimizing the risks. We have seen much growth in our SSVF program with additions of legal, shallow subsidy, and supplemental programs. So with those programs and adding that to it, what is it that we had to do to fine tune and make sure that they work? We've had issues with, for example, with our shallow subsidy program, where the clients were come into the program and then they'd have to be returned back to SSVF because they weren't able to pay their 50% of the rent. So we had to look at what is it that we need to do to make sure that these clients understand how the program works and the goals that are set for them with the program and working with them. Some of the goals we look at, they may want to go into home ownership. They want to maybe help pay down debt. With that extra benefit of being in shallow subsidy, it can help them reach those goals. So one of the things that we developed was we required the veterans to come into the office for orientation. We hold a monthly orientation. And in that monthly orientation, we go through what the shallow subsidy program is, um, rules and regulations of it, and what their responsibilities are, and what their case manager responsibilities are. And we found that we were very successful with this. The veterans, they asked a lot of questions. They asked questions about the program. They shared with us their military experiences. They asked about um, volunteering, wanting to do more. And the most important thing is that we were able to build a rapport with the client. And when they left from that orientation, everyone was on point and everyone was committed to making sure that they did their part so that they can stay in the program and not have to be exited from the program or return to SSVF. And I have to say that we have been very, very successful in seeing the change since we've implemented this. One of the things that we can also look at that compliance helps us to do is lets us know if we have any concerns, what areas that we have our concerns in. It helps us to identify the risk, how we assess those risks, and how we manage and monitor the outcomes of it. We talk about growth in the program. Sometimes those risks and our assessments of these three items will let us know how we need to grow, how we need to develop new tools. So maybe we need to increase our compliance department, adding data analysts to the staff, adding a financial analyst, SSVF financial analyst to staff, uh, making sure that we have routine, independent, and peer review monitoring, making sure that the compliance department or supervisors involved in those routine monitoring, we have our independent monitoring from the VA, CARF, and outside agency hired auditors that come in, and the peer review, letting staff check and review each other's files to make sure that they are in compliance and they are in following. And the peer review we find that to be very rewarding and very helpful because the staff, they communicate amongst each other. They will see if something is off, if someone is having issue with it, and they will talk amongst themselves and they support each other. Next slide, please. So reinforcement and making sure that you nurture that compliant mindset is very important. Make sure that the program manual, policies, and procedures are easily accessible to all staff. You want to make sure that you share any new updates that come out. You want to make sure that you are scheduling compliance audits with your staff. The audits bring into light any gaps or bottlenecks in your compliance plan. You want to develop in-house tracking tools. making sure that you're able to track the growths and declines in your program if you have any. When you are scheduling those audits, we find that 15 to 20% of the cases of your caseloads is a good number to audit for your program. Developing those household tracking tools. We have an auto tracking tool that will auto track the research and their 6 months, 90-day eligibility deadlines. We track high risk and low risk so that when you're looking at the caseload of your case manager's caseload, how many high risk clients do they have? And we want to make sure that the cases that they have, that they are able to handle them. So making sure that you're identifying those high risk and low risk cases is a very good way to make sure and ensure that the compliance monitors are being held to standard. When we look at clear understanding of the roles and responsibilities, so that comes from the case manager's role, your leadership staff role, and the veteran's role. Because yes, the veteran is responsible for compliance also. And one of the big things is that we have to make sure that we share that information with the veteran and make them understand, help them to understand why. And when we have those conversations and that dialogue along with the veteran, we have a better outcome of services. When we want to reinforce how we set this and nurture our compliant mindset, we found some of the things that we've implemented. Weekly office hours for our staff and our case managers. Now, since COVID, my team, we don't have anybody on the team that has been in SSVF since pre-COVID. So everyone is post-COVID. They don't understand how, they didn't know how SSVF worked beforehand. So that's why we try to do multiple ways of reinforcing how the program works to ensure that everyone is in compliance. So we look at the weekly office hours. Now, we set this up with the case managers, our team lead, usually sometimes the supervisors, depending on what the topic is for that week, and whatever areas that they need to be retrained on or have questions about, this is a time where the case manager can come in and they can get clarity on information on how they're supposed to work their cases. These office hours are recorded, and then we place them out on SharePoint so that they can be reviewed. Our staff took it upon themselves, and they have case managers have a peer chat line, and they use that chat line to talk about things that they may not have a clear understanding of, or just wanting to get things through. And often from them having discussions in that chat line, they have a spokesperson that'll come to us in the team meeting and say, hey, this is something that we were talking about and we're on the fence about it. We've looked through the manual. We're not quite sure on the interpretation of it. Can you help us with that? The other thing that we try to do is quizzes. When we have our team meetings, we might, depending on the area that we may see a need, we may throw out a couple of quiz questions, pop quiz questions for them, and they enjoy it because they're learning and they're seeing what they know. So we want to make sure staff has researched an issue or question before they come to you for an answer. Many a time staff would come and, they would ask the question and they're not going to the program manual. So we want to make sure that, they know that program manual. I go to it often myself, and I want to make sure that the staff is in that same frame of mind where go to the program manual, look it up there first, then come to me so that you can say, I researched the manual on page 16 or 17 or whatever the case, it may say da 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 da, but I'm not quite sure if I'm interpreting it right. Can you let me know? And we talk it out. So one of the things, you want to build where they can refer and go back to their frame of reference, and that they can take what they learn and use it to build on to the next issue that they come across, and have them to be able to think on their feet. So making sure that they go back to that program manual and constantly reinforcing that behavior, it's a good thing. Get feedback from the staff on in-house policies and tracking. How we have things set up, what we have do. The staff is very talented, and we want to make sure that we embrace their creativity. Ask them, how do you think we need to track this? Or, what is it that we need to do to make sure that this doesn't happen again? If something, bad happens, don't sweep it under the rug. Bring it out, put it on the floor, staff it, break it down, talk about it, and make sure that staff is included in that, because, your program is only as good as your staff. And we know that we have to be compliant in order for the program to work. So we have to build staff to make sure these things happen. Talk about those risks of being non-compliant. Explain the why. In leadership, you often know why, but staff may not know what the consequences are when things are not done and they're designed to be done. So make sure you explain the why. Make sure that you show them the big picture. Embrace your staff's creativity. They have a lot that they can bring and to the program, and listen to what they say. Consider a rewarding system for embracing the changes and having no compliance errors. Make sure that you let them know when they do a good thing. It's important to give that positive feedback. And the last thing that we do is SSVF Jeopardy. So currently I'm working on updating our Jeopardy game to include, some of the new standards and stuff that we have from the manual. What I like about SSVF Jeopardy is that it is in game form, and I find that they learn a lot about it. They get teams together, they work on getting those answers and getting that, playing this game. And we usually play the game twice a year. Twice a year we have a in-service training where we go over everything from intake to case closing. We do a review, and that's the time when we usually do SSVF Jeopardy. The Jeopardy program, the fun thing about it is that you can manipulate it to whatever areas that you see you need the most concentrated effort or retraining to reinsure. And it has been, very rewarding and very helpful with staff in playing that game. At this point, I have nothing else to share with you, but I am available for any other questions if you have them. Thank you.
Fantastic. Thank you too for those very excellent presentations. Okay, I have both of the panelists on camera and unmuted, so we'll go into Q&A. Have a couple of questions here. This is open to both of you. This is concerning data, but Garrett, if you'd like to start us off, if we can go over a few practices to maintain good data hygiene.
I mean, I think it's all about reviewing your data as frequently as you have the capacity to. You want to have as many eyes on it as you can. Build those systems into program administration. Try to standardize things as much as possible. Make it clear who's responsible for all of the different pieces. I think clear documentation and repeatedly and frequently reviewing your data quality is the best way to keep clean data.
Antoinette, you want to chime in on that, or are you good?
Yeah, agreeing with Garrett says, making sure that the layers are really important. For instance, we have the case manager is responsible for reviewing the data, say if they're requesting TFA, but then we have the supervisor who's also responsible for reviewing to ensure that everything is correct. And then there's a financial person that we have assigned for SSVF that's also responsible for making, sure that things are done correctly. With data, I think that if you see errors in it, it's important to share that with the staff and make sure that they understand seeing the errors. For instance, when we do our monthly upload into the SSVF repository and they kick back that data sheet, and looking at that sheet, are you seeing the same missing, say, missing move-in dates, or some of those commonality things? So is that, you want to determine, is that a user issue or is that a system issue? Because sometimes it's not always, the case manager or whoever missed the date. Sometimes it can be a system issue. But regardless of what it is, when you share that information with the staff and go in and have them go in and look at it, you can start to see where there will be an improvement. And if it is something, then that's when you want to have that office hours and say, hey, we may need to do some retraining on this. And, let's get them together and retrain and make sure that they understand how this is going to go. And use the data to monitor it and make sure that it's making a difference.
All right, so Garrett, one thing I want to rewind here from your presentation is that you made a distinction between being data informed and being data driven. Can you elaborate a little bit more on that? I thought that was a very interesting point.
Yeah, I'll try. That's something I got from my mentor when I first started in the monitoring and evaluation space. I think it was very kind of trendy for a long time to say data driven all the time, right? And I think the problem with that is that data can only capture so much, right? We know that data are true, assuming you have strong data quality, but it's not capturing all of the externalities, those qualitative variables. Maybe the data are showing one thing, but your team, your staff know that there's a reason for that, and you maybe shouldn't enact a policy based on that data. So that's really the difference between data-driven and data-informed. In a data-informed approach, you still have a strong grasp on data. It doesn't mean that you forget about data or data infrastructure. It's just that it's not your sole factor in determining how you're going to make decisions, build out your program, build out a new program, things like that.
I feel like that's something very important to know for like smaller organizations, interested in building that data infrastructure, as you mentioned. Antoinette, this is a question for you, and this is this is asking, what role does transparency play in building that compliance mindset?
Transparency is very important. It's very important for staff to know what they're working with. And like I said, I think I said in one of my things, explaining the why and letting them see what's going on with it. So I'm very vocal and transparent. You will always know where you stand. I believe that when you do that, you build respect with your team, and they do not have to guess about what they are responsible for and what their role is within the program. And knowing that the information that they get from you, that is shared with them, that it is what it is at that time. And we're gonna, if it's something that's not favorable, that you're getting these big sighs from them, that, they know that we're going to have to work through this. So what is it that we can do to make this better? Or what is it that we can do to move through this and go on to the next thing? And remember what your focus is. we're here to serve veterans, and we want to make sure that we are doing this in a compliant manner and that we are taking into account how what we do affects those that we have been tasked at serving. I hope that answers your question.
Yeah. This is an open question here asking what the name of the software is that your teams use for data entry.
So New England Center and Home for Veterans uses a system called ETO, which stands for Efforts to Outcomes. It is a product of a tech company called Bonterra. We've been using that since, oh gosh, I think like 2017 or 18, but we've migrated historical data going back to 2014. The one thing I'll say about systems is I'm not, there was a little disclaimer on my one slide that I wasn't trying to advertise any specific system. I would just say that no system is perfect, but try to shop around and request demos from the different vendors and try to find a system that allows for a certain level of flexibility and customization. But just to know that there's, to my knowledge, not a perfect database out there.
Antoinette, do you have
Sorry.
the question is the name of the software that your team uses for data entry.
Well, what we use is we use our HMIS software, which is Client Track, and that's what we use to gather our information and gather our data. And it's been, the only thing that we've used now for the past couple of years. Prior to that, we were using Pathways, but Client Track has proven to be very efficient in giving us the information that we need and working with the company for any add-ons. One of the great things I like about it is that if we see things on how we can improve it, we can give them that information, and they hear us, because they just put out a bunch of new data standards, and some of the things that were in there were things that we had asked for.
Just for those listening in, I'll be sure to put that in the resource email for you guys to do any further resource like research if you want to implement these systems into your organizations. I'll go, let's see, there's a couple more, but I think we only have time for one more just very quickly here. It says, question is, I think this might be an Antoinette question. Antoinette question.
Sure.
Are case managers trained in customer service in any capacity?
Are case managers trained in customer service?
Yes.
Yes. It is, when we do our training, we talk about how to react to various situations. We talk about how you should don't take it personally, and most of all, respecting your client, paying attention to what they're saying. So yes, customer service is very, very important. At all times, you want them to be respectful. You want to make sure that the client understands that their needs or whatever they're saying is important. And I think one of the most important things that we've had to get across to them is for the case manager not to take it personal. Learn to let the client vent. Then after they've vented, go back and you want to ask them, now, what is it that I can do to help you? Or let's talk about how we can make this situation better. So yes, customer service, we talk about that.
Garrett, do you have anything to chime in on that as well, or?
I can't speak too much to that. I know that our team is trained on customer service. The one thing we have done is internal surveys that track customer service and veteran satisfaction with our services. So, it's something we monitor for sure.
Perfect. All right, so we hit time here. thank you, Antoinette and Garrett, for very excellent presentations and participating in the Q&A, and thank you to the audience for engaging with the webinar. I really appreciate the time you all took out in your day. Before we part, the couple things that I want to make note of in case you weren't here in the beginning is that this webinar is recorded, so we'll send out the recording as well as the slides and any of the resources that we mentioned throughout today in that email. So you'll be able to access pretty much everything if you weren't able to attend, or if you have a colleague that's just interested in taking any notes. A couple things I want to point out is that we are heading into our last webinar next week on Wednesday. So if you are interested in joining that, you're more than welcome to register. We're going to be going over strategic partnerships, specifically on road mapping and forming critical partnerships that can help advance the services of your organization. Another thing is that we have our podcast, The Road Home, which features every Thursday until, I believe, let's say the 23rd. So we're going to be on episode 5, which is on shared housing. It's featuring Luis Rothschild from Apt Associates and Anne-Marie Pluhar from Sharing Housing. Oh, and look at that, there's the slide for next week's webinar. Yes, so on strategic partnerships with Deandra Gorlai from Volunteers of America, Michigan, and Kurt Schack out of the Veterans Transition Center in Monterey, California. So I hope to see you all there, and I hope you all have an opportunity to listen to the recording of this webinar as well as the podcast episode tomorrow. Again, thank you for all your time. I really appreciate it, and see you all next week.
Thank you.